Welcome, everyone, to a special edition of the Living Transplant Podcast. This week, I'm bringing you behind the scenes at the Banff CST conference to introduce you to some incredible people who are presenting all about their innovation and exciting ideas about transplant and how to make this entire journey much better for potential recipients, donors, caregivers, and families, and patients in the system as a whole. Thank you, everyone, for joining us through this journey as we bring you different episodes through the week, so stay tuned for more. Today, I am joined by Dr. Kumar, who is joining us to talk about her presentation called Boosters and Antibodies, Preventing COVID in Transplantation. Welcome, and thank you so much for joining me.
Great. Thank you so much for having me.
I'm wondering if you can introduce yourself to our listeners and a little bit about what you do and who you are.
Sure. So hi, everyone. My name is Deepali Kumar. I'm Director of Transplant Infectious Diseases at the Ejmera Transplant Center in Toronto, and I'm Professor of Medicine at the University of Toronto. So what I do on a daily basis is I see patients who've had transplants and now have infections and prescribe antibiotics and antivirals and antifungals. And I also have a research program where in the last couple of years, we've primarily been working on COVID research.
Amazing. Thank you. That is a topic that I think most listeners are going to be very interested in hearing about today. So thank you so much. I'm wondering if you could tell us a little bit about your presentation this week at Banff.
So at this COVID session, which I'll be presenting at during the CST conference, I'll be discussing two main things. The first is up-to-date information on COVID vaccines and which types of vaccines are recommended for transplant recipients for best protection. I'll be showing some of the research that our group and others have done that leads to making these recommendations. And of course, I'll be talking about how we're going to use the newly approved bivalent vaccines. And then the second part of my talk will be on something called passive immunization and how we can supplement vaccine immunity in transplant recipients with an injection of antibodies.
Oh, that's fascinating. Thinking about your research, how does that impact transplant patients? And thinking about our vaccines and how many we've had and thinking about the number of doses that we've been told to get. I know it's a very large topic to think about, but I'm wondering if you could talk a little bit about that impact to our community.
Sure. One of the most important things that came out of our research was in 2021, we published on the third dose of COVID vaccine. So if you recall back then, the recommendation was that everybody get 2 doses of vaccine. And at UHN, we did a trial that showed that the third dose of vaccine in transplant recipients was a must and very necessary to get good protection. And because of that, the recommendations changed in Canada, as well as the United States, and actually across the world, that the primary series for transplant recipients should be 3 doses. Now, following that, we've been looking at 4 doses and 5 doses of vaccine. And we're leading a large Canadian study that is following over 500 transplant recipients to see how well the 4th dose and the 5th dose work. And what we found so far is that, yes, you definitely get a boost in your antibodies after 4th and 5th doses. So it is very important to keep up to date on those booster doses.
Amazing. And I know there's been a lot in the news lately about Evusheld and the bivalent vaccines. I'm wondering if you could speak to those about how they impact us transplant patients.
So the bivalent vaccine was recently approved in Canada as well as the United States. And this is the same vaccine that we've had originally. So this is an mRNA vaccine, but they've changed it a little bit to include the Omicron strain. Okay. So it actually includes half of the original strain, or half of what it includes is the original strain, and the other half is an Omicron strain. And so what we hope from this vaccine, that transplant recipients would get a better antibody response against Omicron. That's what's been shown in the general population. And our research group is now moving forward to look at bivalent vaccines and how well they'll work in the transplant setting. So the recommendation now is that no matter how many booster doses you've had, that you should receive a dose of the bivalent vaccine 3 to 6 months after any previous booster dose.
And then Evusheld, how is that different from the vaccines?
So Evusheld is something that we call passive immunization. So when you get a normal vaccine, your body has to process that vaccine and make an immune response and make antibodies. Evusheld is just antibodies, so it requires no processing. So you can just get an injection and you, within a couple of days, you have an antibody level. So your body doesn't actually have to process it like it would for a vaccine. And so Evusheld has been found to be effective in reducing the rate of Omicron infections in the BA1 and BA2 wave. We are still waiting for data to see how well it will work for the BA5 wave, which is the current wave. But we hope that it will work in a similar fashion. One thing with Evusheld is that it is not a replacement for vaccination. I think that's something that's important to emphasize. You still need to get your vaccines, but if you want that extra layer of protection, then Evusheld would be the way to go.
Okay. From a transplant patient processing all of this, I've had 5 doses. So really, I should just stop counting my doses and get the bivalent vaccine 3 to 6 months, the current vaccine that I've had. And then Evusheld is also a great booster for me as well to think about getting.
Correct. So we do have to stop counting now. I think we're moving in the direction where what we need to be thinking is, are we up to date with our vaccines? So in the past, it was, have you had 2 doses, 3, 4, 5 doses?
Right.
Now we're moving towards just saying, am I up to date? Which essentially means, have you had a booster in the last 6 to 12 months of the latest vaccine? And in this case, being up to date would mean having that booster of bivalent vaccine in your system. And so what would happen is the priority is getting the vaccination. Then if you want that additional layer of protection, wait a couple of weeks after your last booster, and then go ahead and get the Evusheld.
Okay.
Now, I will say, and I will mention this in my presentation later on as well, that Evusheld is not available in every province.
Right.
Each province has different recommendations and different criteria for administering Evusheld. So I think it's important to find out your province's recommendations regarding Evusheld.
Fantastic. Thank you. That is a great overview of such a huge, massive topic and a lot of hard work and research. And from the perspective of all of us transplant recipients, I just want to say thank you for all of the hard work that you've done and that your team has done at UHN, because throughout this process, it has been very scary and very isolating to be a transplant recipient through the pandemic. But knowing that we have researchers and doctors and a whole team behind us who are really working towards making sure that we are safe has made it a lot more manageable for us. So thank you so much for everything that you and your team has done. It's really greatly appreciated.
Thank you.
And I'm wondering if you have anything else that you would like to share with our Living Transplant Podcast audience.
I'll just say that even after you've gotten your vaccines and Evusheld, I think it's still very important to take those precautions. If your immune system is suppressed, it is still important to avoid those crowds and wear a mask and protect yourself. I think we're just going to have to learn to live with COVID. It's not going away anytime soon. And I think it has established itself in the population and it will probably continue to circulate. We'll probably see waves in the future. And so I think personal protection will still be really important.
Fantastic. Thank you so much. I'm so grateful that we've been able to steal you away for a little bit of time to bring all of this amazing research and information to patients and families. So thank you so much for being with me today.
Thank you.